Picture this for a second. You work 40 hours a week, you pay your dues, you show up, and then at the end of the month, you get a bill for health insurance. Just the premium, not even the copays, for $800.
For a family, that's a mortgage payment in some parts of this country. That is a crisis.
It's a crisis, and frankly, for a union member, it should be unacceptable. But we see it happening. We see unions settling for these high premiums, getting trapped in bad negotiation frameworks. So today we are doing a deep dive into the second paycheck healthcare.
Which is exactly what it is. It's compensation.
Right. We're going to look at specifically why a union with, let's say, 40,000 members has no excuse for high premiums. We're going to break down the difference between cost-neutral negotiations, which I think you're going to tell us is a trap, and progressive negotiations. And we're going to look at the unions who are actually getting it right, like the Teamsters and Unite Here.
I'm ready. This is the stuff that actually changes lives.
So let's start with that number I threw out, 40,000 members. Why does that number matter? If I'm a union leader and I walk into a room with 40,000 members behind me, what does that get me in the healthcare market?
It gets you everything, Noah, if you know how to use it. See, in insurance, size is destiny. If you have 500 members, you're at the mercy of the insurance company. You're buying a product off the shelf. But at 40,000 members, you are the market.
You're not buying the product, you are the product.
Exactly. At 40,000 lives, and remember, that's usually times 2 or 3 for families, so we're talking maybe 100,000 covered lives, you have what we call market-moving leverage. You can self-insure. That's the first big key.
Break that down. Self-insure versus fully insured.
Okay, so fully insured is like renting an apartment. You pay Blue Cross or Aetna a flat premium every month. If your members stay healthy and don't spend that money, the insurance company keeps the profit. They win. You lose.
So they're betting against you getting sick.
Always. But self-insured, that's like buying the house. The union, or the trust fund, holds the money. You pay the medical bills directly as they come in. You might hire an insurance company just to process the paperwork, but they don't keep the profit. If your members are healthy, or if you negotiate better prices for heart surgery, that savings stays in the union's pocket. It doesn't go to a CEO on Wall Street.
And 40,000 is enough to do that safely?
Oh, easily. 40,000 is a fortress. With that many people, the risk is spread out perfectly. So when we hear about a union of that size, where members are paying $800 a month premiums, that is a failure of imagination. That is a failure to use the leverage of the group.
So why does it happen? I want to get to this concept of cost-neutral versus progressive negotiations, because I hear cost-neutral, and it sounds harmless. It sounds balanced.
It's the most dangerous phrase in labor bargaining.
Why?
Because cost-neutral is accounting trickery. Here's how it works. The employer sits down and says, we spent $100 million on healthcare last year. We are willing to spend $100 million next year. Not a penny more. We want to be cost-neutral.
But medical costs don't stay flat.
Right. Medical inflation is usually running at 6%, 7%, sometimes 10% a year. So if the company freezes their contribution, who pays that extra 7%?
The worker.
The worker. Cost neutral for the employer means cost increase for the family. It's a mathematically guaranteed pay cut. They'll say, okay, to keep the company costs flat, we need to raise your premium from $200 to $400, or we need to raise your deductible from $500 to $2,000.
So you're essentially cannibalizing the benefits to keep the employer's balance sheet.
Precisely. You are managing the decline. You're rearranging deck chairs on the Titanic. That is the cost-neutral trap. And a lot of unions fall into it because they think, well, at least we kept our wages.
But if I get a 3% wage hike and my premium goes up $400 a month, I didn't get a raise.
You got a pay cut. And that brings us to the alternative, progressive negotiations. Now, this isn't just about politics. This is about being aggressive and structural. Progressive negotiation means you stop arguing about who pays the bill and you start attacking the size of the bill itself.
Give me an example. What does a progressive negotiation look like for that 40,000 member union?
Okay, look at Unite Here. They represent hospitality workers, hotel maids, cooks, casino workers, not exactly investment bankers. These are working class folks, but their health plan in Las Vegas is legendary. It's basically free to the member, $0 premium.
Zero? How?
Because they went progressive. They didn't just buy insurance. They realized, we have so many members in Las Vegas, why are we paying a hospital markup? They built their own health centers.
Wait, the union built a clinic?
They built full service medical centers, pharmacies, primary care, urgent care, the Unite Here health centers. By hiring their own doctors and buying their own drugs wholesale, they cut out the insurance middleman and the hospital profit margin. That is progressive. They changed the structure of the market.
That's amazing. So instead of fighting over a premium hike, they just removed the cost drivers.
Right, and even if you don't build a building, you can do this. Look at the 32BJ SEIU in New York, the building service workers. They have huge numbers. They found out that certain big name hospitals were charging them 400% or 500% of what Medicare pays for the same procedure.
So they were getting price gouged because they were just blindly paying the bill.
Exactly. So a cost neutral negotiator would say, oh, well, prices are up, let's raise member premiums. The progressive negotiator, 32BJ, said no. We are threatening to drop that hospital from our network entirely unless they lower the price.
That's playing hardball.
And it worked. They saved millions. They forced the hospital system to come to the table because 40,000 members plus their families is too much business to lose. That keeps premiums low without hurting the workers.
It seems like the difference is passivity versus activity. Cost neutral is passive. Progressive is active.
100%. If you have 40,000 members and you are accepting an $800 premium, you are being passive. You are letting the insurance company dictate the terms. You mentioned the Teamsters earlier. Look at the UPS contract.
Yeah, that was big news recently. What's the situation there?
Teamsters at UPS pay $0 in premiums for individual and family coverage in many regions. Zero. And very low copays. Why? Because they treat healthcare as a hard line in the sand. They prioritize the benefits pool. They control the funds in many cases through the Teamster welfare funds. They don't let UPS simply shift costs.
And that's a massive group. We're talking hundreds of thousands. But the principle is the same for 40,000.
It is. In fact, 40,000 is arguably the sweet spot. You're big enough to demand direct contracts with hospitals, literally bypassing the insurance carrier, to say, we will send you all our knee replacements if you give us a flat rate of $20,000. But you're also agile enough to communicate with your members and get them to use those programs.
I want to talk about the flip side. What happens when a union gets this wrong? I'm thinking about Boeing.
That is the cautionary tale. The IAM, the machinists at Boeing. For years, there was this slow erosion. The company moved towards cost-neutral strategies, shifting more burden onto the workers. And what happened? In 2024, the strike wasn't just about wages. It was heavily fueled by the fact that the company tried to weaponize healthcare.
They cut the coverage during the strike, right?
They cut it off immediately. But even before the strike, the dissatisfaction was brewing because the quality of the insurance had degraded, higher out-of-pocket costs. When you have a union that allows the employer to treat healthcare as a line item to be slashed, you destroy morale. And eventually, you get a rebellion.
It creates a debt of anger.
It does. And look at the contrast. When the UAW struck the automakers or when the Teamsters threatened UPS, healthcare was the shield. They protected it. They didn't trade it away for a slightly higher hourly wage.
Let's circle back to that family paying $800 a month. I want to be really clear about what that number means. If you're making, say, $60,000 or $70,000 a year, which is a decent trade wage, $800 a month is nearly $10,000 a year. That's post-tax money usually, or it's eating into your gross. That's a 15% pay cut just to stay alive.
And that's before you even see a doctor. That's just the right to have the card in your wallet. It's unacceptable. For a union of that size, paying $800 a month suggests the union negotiators are operating on a fully insured model where they are just accepting the carrier's renewal rates every year. They aren't auditing the claims. They aren't managing the pharmacy benefits.
Pharmacy's a big one, right?
Huge. If you aren't doing progressive negotiations on pharmacy, you are getting ripped off. The spread pricing, where the middleman keeps the difference between what the drug costs and what you pay, can be massive. A progressive union audits that. They demand pass-through pricing. They can save 20% just on drugs alone.
So if you're a member listening to this and you're staring at that $800 deduction on your pay stub, what should you be asking your leadership? What is the question?
The question is, are we self-funded? And if not, why not? And the second question is, are we cost shifting or cost managing? Because if the leadership comes back and says, well, healthcare costs went up, so we had to raise your premium, that is not leadership. That is administration.
Oof, that's a distinction.
It's the truth. Leadership is saying healthcare costs went up, so we formed a coalition with other unions to demand lower rates from the local hospital system. Or we implemented a wellness center to catch diabetes early so we don't have catastrophic claims later. That is what unions are supposed to do.
Because that's the historical mandate, isn't it? I mean, unions basically invented employer-sponsored healthcare in the 40s.
They did. During the wage freezes of World War II, unions couldn't negotiate higher pay, so they negotiated benefits. It is in the DNA of the labor movement. To treat it as an afterthought now, or to let members drown in premiums, is a betrayal of that legacy.
I love the phrase you used earlier, the best possible benefits. It sounds simple, but it requires so much work.
It requires sophistication. You need actuaries on your side. You need data. There's a union in Boston, Local 26, Hospitality again. They managed to get premiums down to pennies on the dollar compared to the national average. How? By analyzing the data and realizing that sending members to the most expensive teaching hospital for routine procedures was bankrupting the fund.
So they steered them.
They created a network. They said, if you go to this high-quality community hospital, it's free. If you go to the fancy place that charges 3x more for the same MRI, you pay. They guided the care. That's progressive. It saved the fund, lowered premiums, and the health outcomes stayed exactly the same.
It's smart. It treats the members like adults and partners in the plan.
And it protects the wallet. That $800 a month family could be putting that money into a college fund or a mortgage or retirement. When a union reclaims that money from the healthcare industry, that is a direct transfer of wealth back to the working class.
So, to wrap this up, if you have 40,000 members, the toolbox is full. You have self-funding, you have direct contracting, you have coalition building. There is no excuse for the status quo.
None. The status quo, cost neutral, is a slow death. Progressive negotiation is the only way to survive. Unions have to stop acting like insurance customers and start acting like insurance owners.
Powerful stuff. If you're in a union or you're organizing one, take a hard look at that health plan. It's worth fighting for.
It's the fight of our lives, honestly.
Thanks for breaking it down, Eloise. And to everyone listening, if you know someone stuck paying those high premiums, send this episode their way. Sometimes knowing what's possible is the first step to getting it.